Okay, let's talk about a knee condition that we see and treat pretty regularly. It's a meniscus tear or some type of injury to the meniscus, and a lot of people don't know what the meniscus is, so I thought it'd be helpful just to go over the anatomy. Okay, so looking at the knee, we're looking at the front of the knee, and this is your kneecap or your patella. So if I'm going to flip this around, okay, we've got ligaments that support the knee. You got the LCL and the MCL, and then the ACL and the PCL. And between the two bones, this is your femur and your tibia, you've got your medial meniscus and your lateral meniscus, and these act as kind of like a shock absorber, a cushion between those two bones. And when you tear or strain or do something to the meniscus, it's usually the medial or the lateral, whichever one that you've torn, that is what gets injured, and it's hard to recover or heal because it gets very poor blood supply. Okay, how do people injure it? Or what's the mechanism of injury? Usually, most commonly, it is when your foot is planted and you twist at the knee. So think of like skiing, right? You're going down the hill and you somehow twist and fall and that knee twists, or you're playing soccer, basketball, any type of sport, you go to plant and juke and you twist at the knee. I've even seen a lot of times where people get hit and they come and get hit right at the outside of the knee and it causes that knee to cave in and twist. Boom, that's what typically will tear a meniscus. Okay, let's talk about the signs and symptoms. How do you know? So oftentimes when you go to the doctor, they may send you to physical therapy first without even doing like an MRI. We're going to try to do some physical therapy first. And so I'm going to look for, is there weakness? Obviously you're going to have a lot of pain, weakness in the quads and the muscles that surround the knee. Typically a sign I see is like clicking or popping or catching, almost like it locks up or even gives out. When you do like a deep squat or go up and down stairs, that's usually painful. And then any type of twisting, remember how we talked about how it happens? So if your foot is planted and you twist, that's going to cause a lot of pain too. Those are some of the signs that you can kind of pick up on whether you have a meniscus tear or not. Okay, so how do we treat it? When somebody comes in, we've got to basically do an examination to know what we're dealing with. Is this actually tear, is it not? So we'll kind of create a custom plan to you and your specific condition. But again, most orthopedic surgeons, most of your family med doctors, your primary care, they're going to send you to PT first. And the whole goal is first, get your range of motion back, and then start to work on the strength and the stability of the knee. All of those muscles that have been injured or possibly strained, we've got to work on, basically building back the strength and the stability of the knee. We've got to modify your activity, whether it was a sport, skiing, something that actually caused it, we've got to modify that activity. We're going to go over principles like price, protect it, rest it, ice it, those type of things. But really the goal of physical therapy over the first couple of weeks, maybe a month is, can we start to restore range of motion and strength and function to the point where, hey, you're feeling better and you don't feel you need to go down the road of a surgery. If, on the other hand, we do 6, 7, 8 weeks of therapy and you're just not getting better, then we go back to the orthopedic surgeon, we do an MRI and we determine how bad is this, how severe is this, is a surgery even needed? But the hopes is that physical therapy can actually help you with the healing process, stimulate blood flow, we'll do manual hands-on therapy, we'll strengthen and stabilize that knee to basically get you back to functioning, to hopefully help you avoid a surgery and get you back to sport or whatever it is that you're looking to get back to doing.